When should you be starting to worry? When should you see your vet? Let's get your cat back to feeling their best. You've clicked on this video because your cat's having diarrhea and you're worried about them. It's Dr. Liz Cat Vet. I see this problem really commonly in practice. By the end of this video, you're going to know common causes of diarrhea, what home remedies you can try, and when you should really be seeing your vet. Starting with the causes. It does really depend on whether they're young or old. Kittens really commonly get diarrhea. They're brought to a new home, have a change in diet. That's one of the biggest causes, just simply a dietary change. Their gut flora is not used to digesting that food. Depending on how severe it is, it may just be a wait and see approach. If there's blood, should you worry? We'll talk about that more later in the video. Another common cause is parasites, and kittens are particularly prone to this. So the person who's selling the kitten should be already on top of this regular worming from 2 weeks of age because they are so prone to it. But unfortunately, it doesn't always happen. So speak to your vet about getting them up to date with treatment if not already. And it does also depend on their lifestyle, what they're eating, raw versus cooked food, indoor-outdoor lifestyle.
Tapeworming tablets can only be bought over the counter from your vet. It's one of the things commonly missed in a lot of the topical over-the-counter wormers. Cats eating raw meat or lizards will need tapeworming because it can cause diarrhea. Once every 3 months, or if your cat has diarrhea.
There are different, more trickier parasites to diagnose. Like sometimes you do need a little fecal sample. The grosser, the better. And if it's fresh, great, take it into the vet. Sometimes it is good to select 3 samples so you can refrigerate it, obviously wrapping it in a container, in a bag, so it doesn't come into contact with your food, because there are definitely some parasites, infections that can be transmitted to humans, especially the more vulnerable amongst us. We also look about the basic things with causes of diarrhea. So is there stress? Have they had a recent visit to the vet for another reason? Are they on medication? Because a lot of those medications we give will upset their tummy. So it can just be as simple as that. In older cats, we are more looking at extra organ disease. So pancreas, liver are the big ones, kidneys, thyroid. Really common disease that also affects young cats is food responsive enteropathy. So basically, fancy way of saying they're allergic to protein, like the food they're eating, and that can cause gastrointestinal signs such as vomiting and diarrhea. Inflammatory bowel disease and small cell lymphoma are also really common conditions in cats just due to genetics, and unfortunately it's something we see a lot in practice. The number one thing that we generally tend to recommend is a diet change. Switching to a cooked chicken meat, the reasons for this is easy to digest protein. Cooked is safer because it's killed all the bacteria. Contrary to popular belief, freezing the meat does not kill the bacteria. It does kill the Toxoplasma parasite, protozoan, but it doesn't kill the bacteria. So definitely cook it. What do you do if your cat won't eat it? I'll talk about that in a bit. If that's not an option or if it's sort of minor, you can potentially stick with their diet, but just add in a prebiotic. So what are prebiotics? It's basically the food for the good bacteria in your gut. It can be as simple as psyllium husk. It's the stuff you find in Metamucil. And obviously you want the flavor-free stuff. It's really cheap. You can get it at pharmacies and supermarkets. Add in 1/4 teaspoon twice a day. Other things to try is fiber. So it's really common in America to get this canned pumpkin. It's a little bit harder to find in Australia, so you may have to actually buy the pumpkin. Cook it is best. It's going to be easier to digest. Again, like the chicken, some cats might not actually want to eat it, but it does have a sort of a sweet flavor, so it definitely can be worth a try. How much pumpkin to feed? Aim for a tablespoon twice a day, but if this is too much for your cat, something's better than nothing. Try a smaller amount mixed in, or even try it just separately on the side. Some cats might actually just lick it off the spoon. If your cat won't eat the cooked chicken, head down to your local vet or pet shop. Over the counter, you can purchase the gastrointestinal canned food. It is available in dry food, but with the diarrhea, they're going to be dehydrated. Even if it's not obvious to you, even if they're still drinking water, they're losing way too much fluid. They can't make up for what they're losing. So you need to feed them more moisture in their diet than you normally would. More water bowls around is great, but canned food and gastrointestinal is the best. Probiotics are readily available, and you can even buy these over the counter now from pet shops. There are certain ones that you'll see more available on the floor versus the ones that you have to actually speak to a staff member to make sure it is suitable for your cat. You'll find on there, there'll be instructions saying use for this number of days. And the reason for that is because if the diarrhea is turning chronic, you need to be investigating is there another reason for this? And we can't just be giving probiotics and hoping for the best when it's not actually getting anywhere. So that's one of the times you need to see a vet. I'll tell you more about when you need to see a vet in a bit. Make sure their worming's up to date. If you need assistance with this, your local vet clinic will be happy to help, either tell you the right product you need or even administer it for your cat if they're a bit difficult. When should you be starting to worry? When should you see your vet? So if you see a little speck of blood in the poo, in the stool, that means there's inflammation in the gut. Making sure your cat couldn't have been exposed to rat bait. Eating the rat itself would be the more common thing because that's their natural diet. Does your cat have outdoor access or not? Obviously, we'll help you decide there. We also will see this slime jelly-like substance. That's mucus. That suggests inflammation as well. Don't be super concerned if there's just a small speck of blood. Obviously, a very large volume of blood is very concerning, especially if your cat is flat, not eating, not drinking. Not eating for more than 24 hours is key. Even up to 48 hours, that becomes basically an emergency because cats can get secondary liver issues simply from not eating. If you've tried all these suggestions and your cat is not getting better and it's been 48, 72 hours, the stool's getting worse or it's not getting better, definitely call your vet. Another reason when you should see your vet is if your cat is old. They're more prone to secondary issues with kidneys, liver. They're less likely to be able to compensate for that illness, and you should get them checked out anyway because they're more likely to have organ disease. Like this video if you found this useful, and comment below with what you've done with your cat to help with their diarrhea, to help other pet parents. Thanks for tuning in. See you in the next one.